Saradha Saranu, working as professor at Kamsasi Medical College, LB Nagar, and as consultant in Kamineni hospitals. Now I am speaking about abnormal uterine bleeding and its causes, diagnosis and treatment. If you got any doubts regarding this problem, you can raise your queries in the chat box at the end of the session. I'll try to answer as many as possible. Okay. Now, what is abnormal uterine bleeding? Before knowing the abnormal bleeding, you should know what is normal menstrual cycle and normal bleeding. So, normally the menstrual cycle lasts once in 28 days and the bleeding lasts for 3 to 6 days. If the bleeding is less than 2 days or if the bleeding is more than 7 days, it's abnormal. Then if there is a scanty bleeding, that is the amount of bleeding is less than 10 ml, it is abnormal. If it is more than 80 ml, again it is abnormal. So this how you will assess. Usually we'll ask the patient how many number of pads they are changing, what is the amount of bleeding, and how whether it is associated with clots or clots. All these questions, when we are asking the history, we will be asking the patient. Again, in the normal menstrual cycle, usually they will have pain on the first day of the cycle. If they have pain during the entire cycle, again it is abnormal. So to know the abnormal, we should know the normal before. I have told normal menstrual cycle once in 28 days, the bleeding lasts 3 to 7 days and it will be associated with mild pain. So if they have excess bleeding, more than 7 days bleeding or less than 2 days, it is abnormal. Again, if it is associated with pain, it is abnormal. Then if they have less than 3 weeks, that is 21 days, it is abnormal. Or if it is more than 32 days, again it is abnormal. This will have medical terms like menorrhagia means excessive bleeding. Then polymenorrhea means frequent periods. Like that we will be having. These technical terms may not be useful for you, but practically how it occurs, the menstrual cycle, that history of menstrual cycle or menstrual cycle abnormalities, you will be asking in detail while asking the history. So with the history only we can get many causes or almost about the diagnosis we can come to if the patient gives correct history. When the patient gives her complaint and history, it is better to give the correct history. If they won't tell proper history, then it may be difficult for us to come to a diagnosis. We will have many differential diagnoses and we may have to write many more investigations. If the patient gives correct history, then sometimes even without investigations we can write. Some people, they will be taking this postponement tablets, hormones by themselves, and they will have irregular, if they take that tablets irregularly, they will have irregular bleeding. They will have bleeding for 2 days, 3 days, and then again they will take the bleeding stops, again they stop the tablets, again they will have bleeding. So this type of thing, if they won't tell the history, then it will be difficult for us to come to the diagnosis. Then what is abnormal uterine bleeding? I said if it is more than 7 days or if the bleeding is more than 80 ml, it is called abnormal uterine bleeding, or in between the periods if they have got bleeding, it is called abnormal uterine bleeding. It is in between the periods if they have got the bleeding, it is called Menorrhagia, and it gives certain diseases will have present with Menorrhagia. Then if they have got less periods, that is oligomenorrhea, that in certain diseases they will have that. So what are the causes for abnormal uterine bleeding? So all the patients, all the age groups in the female, they can affect with the abnormal uterine bleeding at any stage of their at any age they can be affected. That is maybe in the childhood or in the adolescence or in the during active reproductive life or in the perimenopausal period or in the postmenopausal period. In the adolescent, just before the menarche or even at birth also sometimes they can have abnormal bleeding. That is because sudden fall of the estrogens when the baby delivers. If the female baby delivers, in utero they will be having lot of hormones. So that hormonal influence will be lost, and immediately after the birth on the first or second day there will be some bleeding from the vagina, and the mothers and grandparents, they will show concern. What is the reason for this bleeding? Will be just assurance and cleaning will tell them for that bleeding at birth. Starting from the bleeding at birth, this is also abnormal, but it is physiological and nothing to worry. And rarely the common cause for bleeding in the children is keeping foreign body. That we have to educate the child not to keep anything and not to meddle the internal genitalia. And nowadays the cases of rape in the children also increasing. We have to see that also can cause bleeding. Then rarely ovarian tumors and sarcoma botryoides, that also can cause bleeding in the children. Then in adolescent age group, usually after menarche, they will be having bleeding for 2 to 3 years after menarche. That is because of immaturity of the HPO axis. That means the pituitary hypothalamus axis maturation, it takes time. So for that reason they can have bleeding in the adolescent age group. That also we have to ask. The patients can present with abnormal uterine bleeding at any time. So we have to ask them also regarding these things. Then during the active reproductive life, that is say 15 to 40 years, the common causes are related to pregnancy. The common causes for bleeding are related to pregnancy. That is either abortions or ectopic pregnancy, then hydatiform mole or gestational trophoblastic disease. Hydatiform mole, usually they will call it as molar pregnancy, and it is called Muchala Garbhini in Telugu. It can be due to this also they can have abnormal uterine bleeding. Another cause is infections following delivery. If they have got infection, endometriosis, that also can cause. Then sexually transmitted infections or local vaginal infections can also cause chronic pelvic inflammatory disease, and that also can cause abnormal uterine bleeding. These are all the common causes during the reproductive life. Again, another common cause for abnormal uterine bleeding is fibroids. That is tumors in the uterine cavity. It can be in the cavity or in the myometrium or in the subserosa. These fibroids can cause menorrhagia or excessive bleeding if they are located in the mucous uterine cavity. Then endometriosis or adenomyosis. This also occurs because of presence of endometrial tissue in the myometrium, that is inside the uterine muscle, or in the ovary or elsewhere. That is called endometriosis. This also can cause abnormal uterine bleeding. Then malignancies and hyperplasias, that is endometrial hyperplasia, in which the uterine lining will be increased and it causes bleeding, excessive bleeding. Same thing, it may lead to malignancy, that is endometrial carcinoma. The lining of the uterus will develop cancer and can cause excessive bleeding. And then cervical cancer, it can cause intermenstrual bleeding. Cervical polyps also can cause intermenstrual bleeding, that is in between the periods they will have bleeding. Then polyps, even benign polyps, this excessive endometrium, they may develop into polyps, and that also one of the common causes for bleeding. Then submucous fibroid polyps also can cause bleeding. Then another thing, common causes is endocrine disorders, especially thyroid. Either if it is less also can cause abnormal bleeding, or if it is more also it can cause abnormal bleeding. Either hyperthyroidism or hyperthyroidism, both can cause abnormal uterine bleeding, either excessive bleeding or scanty bleeding. In initial stages they will cause excessive bleeding. Then in the, if the severity of this disease is more, it will cause amenorrhea, that means scanty periods or no periods at all it occurs in thyroid disorders. Then in case of prolactin, hyperprolactinemia, if the prolactin hormone is excess, it also can cause oligoamenorrhea, that means less periods. Then commonest cause in reproductive age group is polycystic ovarian disease. In this there will be cysts in the ovaries. Usually the patients will be obese, they will have irregular cycles, scanty periods and infertility, that means they won't be conceiving because of anovulation. These people also will have irregular bleeding. Then if they have children and if they develop these symptoms later on, they have endometrial hyperplasias because of chronic anovulation, because there won't be release of ovum, that leads to the development of increased endometrial thickness due to hormonal imbalance, and they will have excessive bleeding even in polycystic ovarian disease. Then even thyroid disorders, they will develop anovulation and it causes increased bleeding. Then another common cause is coagulopathies, that means bleeding disorders. What bleeding disorders will cause excessive bleeding? Commonly idiopathic thrombocytic purpura, that means platelet abnormalities also can cause excessive bleeding. And Von Willebrand disease, in this is a genetic disorder which runs in families. It also can cause excessive bleeding. Then Christmas disease, where there will be abnormalities in the Christmas factor, that also can cause abnormal uterine bleeding. Or if they have some leukemias, blood cancer, they may present with abnormal uterine bleeding, and if you investigate, if you do complete blood picture, blood test, if you do, you will diagnose the abnormal white cells, and you can diagnose the leukemias from the gynecologist. Gynecologist will diagnose and it will be referred to the medical oncologist for further management. Then medication, irregular medication, some anticoagulants, usually in case of heart diseases or in case of infertility where there is a Aplas syndrome or some medical disorders, we will be prescribing anticoagulants. And like antiplatelet factors, clopidogrel, aspirin, if you take these medications, and because of this prevention for coronary artery disease, we will be using aspirin tablets. These medications also will cause excessive bleeding and also sometimes hematuria. So taking history is important regarding medication. And irregular usage of hormones, as I have told, many patients, they will be taking progesterone tablets for postponement, and then they will present with excessive bleeding. So medication. Then some non-specific disorders also can cause not classified disorders like malignancies, ovarian tumors, also can functional ovarian tumors, follicular cysts also can cause this excessive uterine bleeding. These are all the causes for bleeding. Then how will you diagnose? First, clinical examination is more important. Then after taking the history, detailed history taking is also important, which I have already told. Then clinical examination, we have to see the general condition of the patient. Patients usually will be anemic if they have excessive bleeding. Then if they have got polycystic ovarian disease, they will be obese, hirsutism will be there, facial hirsutism, there will be hirsutism below the umbilicus and underneath the thighs. Inside the thighs they will have hirsutism. Then if they have got thyroid, it will be thyromegaly may be there. Then they may have thickened skin, pulse rate will be less. All these things we can see clinically and then diagnose. Then after the clinical examination, we have to do a pelvic internal examination. With this internal examination, we can diagnose fibroids, then ovarian cysts, endometriosis, infections, chronic pelvic inflammatory disease. We can diagnose with clinical examination. After finishing the clinical examination, if we can come to a diagnosis, we can prescribe the medicines with clinical diagnosis only. But if there is a doubt in the diagnosis, we can to confirm the diagnosis. Now we are going everything by doing evidence-based medicine. For that reason, we may be writing some investigations like ultrasonography, blood studies, basic blood studies, routine blood investigations like complete blood picture, urine examination, then hemoglobin, then HBS antigen to detect whether they have got viral infection in the past, then HIV infection, then VDRL test, then blood group and RH typing, and thyroid profile to know whether they have got thyroid dysfunction. These routine investigations we will be doing. Then after doing these things, we will be advising ultrasonography, that is scan. In the layman's term we will say scan. By doing this scan, either per abdomen or per vaginal, that is TVS scan, we will be getting the information whether she has got fibroids, or if she has got fibroids, we will be knowing the location, number and all. Then if she has got ovarian cyst, we will be knowing what type of ovarian cyst it is. Then we will be knowing the endometrial thickness. Then after knowing the endometrial thickness, whether there is adenomyosis, that means the endometrial glands in the myometrium, that is in the uterine muscle. Then chocolate cyst, that means presence of endometrium in the ovary. All these things we can, this information we will get by doing ultrasound. Then sometimes if the polyps also in the cavity, what type of polyps they are, whether fibroid polyp or endometrial polyp, sonosalpingography means another investigation. It will help in us for differentiating the thing, type of polyps. And again we can do hysteroscopy, that means visualizing the uterine cavity with an instrument, with scope, telescope like thing. We will be visualizing the uterine cavity. In that we will be seeing the polyps or hyperplasia or intrauterine adhesions, and sometimes it helps in the diagnosis, especially in cases of infertility. And if they have got polyps, we can do polypectomy through hysteroscopy, and that is both diagnostic and therapeutic. It will help. It helps in diagnosis and treatment part also, hysteroscopic diagnosis. Then sometimes in some cases we may do laparoscopy, and in rare cases we may need to go where the diagnosis is in doubt. We may have to do further investigations like MRI and CT, where we won't be able to diagnose by ultrasound or hysteroscopy or sonosalpingography. Then we may do MRI to confirm our diagnosis or to get a definite diagnosis, especially in cases of endometrial carcinoma, polyps, then sometimes chronic PID, endometriosis. In these cases, and uterine abnormalities, congenital malformations of the uterus, in these cases to get the definite diagnosis we may proceed to do MRI. And in cases of malignancy, that is either endometrial cancer or cervical cancer, to know the spread of the disease also we will be doing MRI and In case of ovarian cysts also we will be doing CT scan. These investigations we won't do routinely for every patient. For rare cases where you want to know further diagnosis and further planning for the treatment, in these cases we will be doing these things. Then this is in the active reproductive life. Again, postmenopausal patients also can present with abnormal uterine bleeding. That means usually menopause occurs around the age of 45 to 52 years. In a common age for menopause is around 47 in Indian females. So if they get, after stopping of the periods, if they get bleeding, it is abnormal. Usually the common cause is the atrophy of the tissues and lack of hormone will cause this bleeding. Whereas in case rare cases where if the endometrial lining, that is the cavity of the uterine lining is more than 4 millimeters, we have to do endometrial biopsy and to know the cause, whether it is a polyp or a fibroid or malignancy. To know the cause, we have to remove the tissues and send for the histopathological examination, and then accordingly we have to do. But the commonest cause is atrophic endometritis, vaginitis and cervicitis. This is the common cause for postmenopausal bleeding. There will be other causes like fibroids, then ovarian tumors, then endometrial carcinoma, cervical cancer. All these things also can cause postmenopausal. Another common thing is foreign body or sometimes forgotten IUCDs, and sometimes one of the causes for in the active reproductive life is the IUCDs. Copper T is another common cause for bleeding, and use of OC pills irregularly also can cause bleeding. And then if the patients, postmenopausal patients, if they take HRT, that also can cause. And in the postmenopausal patients, usually they will be using aspirin or clopidogrel for their prevention for coronary artery disease, or if they are suffering from these heart problems, they will be using. This is also another common cause for postmenopausal bleeding. So we should know the cause, and after knowing the cause, we have to treat the cause. So for the treatment, again it depends. If it is because of hormonal imbalance, PCOD or endometrial hyperplasias, the treatment will be hormones. We will be prescribing. The acute episode of the bleeding we will treat with local non-steroidal anti-inflammatory agents, that is to reduce the bleeding, or you can treat with tranexamic acid. Then this is temporary treatment. Then we have to know the cause for the treatment. If the cause for the treatment is hormonal imbalance or endometrial hyperplasias, then you can give hormones. That hormones we have to give cyclically. Usually will be the cause for hormonal imbalance is ovarian dysfunction, that is anovulation. So in this the progesterone hormone is lacking, so we will be supplementing the progesterone hormones in either oral form or combined oral contraceptive pills or progesterones or injectable progesterones or Mirena, that is IUCD, LNG intrauterine system. These hormones we can give, and in case of young age group we will try this. Then in the late age group we can try, after excluding the endometrial cancer, we can insert Mirena, that is hormonal IUCD, that causes menopause and reduces their symptoms. If they won't respond to these medicines, then you can go for hysterectomy. The final treatment for the abnormal uterine bleeding, either because of hormonal imbalance or fibroid uterus or endometrial cancer or cervical cancer, anything, usually the final treatment is hysterectomy, and the type of hysterectomy depends on the cause for the disease. Then in case of early diseases, sometimes endometrial hyperplasias or hormonal imbalance causing excessive bleeding, you can try where they are not willing for the surgery, where they want to conserve the uterus, you can try endometrial ablation therapy. In that, you will be inserting the balloons inside the uterine cavity, and you will be sending either heated water and then ablate the endometrium, or laser waves and then ablate the embryo endometrium, or you can do cryotherapy in the endometrium with special equipments. But if the patient wants to conserve their reproductive function, then it won't help. For them, you have to do other methods like hormonal replacement therapy and all. You have to try. Then in the active reproductive life, where they want to conserve the uterus or where they want to have children, then in case of fibroids, we will be doing myomectomy. For those who has finished their childbearing, we will be doing hysterectomy. Then in case of fibroids, finished childbearing but still want to conserve the uterus, then you can do uterine artery embolization therapy or FIGLU, that is ultrasonographic guided ablation of the fibroids. This also you can do in case of fibroids. Then in case of cancers, depending on the endometrial cancer, we can do hysterectomy, whereas in case of cervical cancer, you can do radical hysterectomy, where you will be removing the lymph nodes also. But in case cervical cancer occurs in the young patients, where sometimes they may not have finished their reproductive life and where they want to have children, then you will be doing tracheolectomy, that is removal of the cervix and with lymph nodes. Then you can do, and you can preserve the uterus for their future reproductive life. These are the managements, various managements that are available for the abnormal uterine bleeding. So if you have got any questions or doubts, you can keep it in the chat box. ఉన్నాయా క్వశ్చన్స్? నాకు ఇక్కడ రాలేదు. What treatment approach do you recommend? I'm not a Shiva is asking. Huh? How to stop uterine bleeding naturally? It is a question asked by Kasogi Shiva. It's nice question, but uterine bleeding, usually normal vaginal bleeding, it stops on within 5 days. If it is prolonged for more than 7 days, you may have to give the treatment and you have to investigate. Usually once in a way, the patient, if the patient is under stress, which I haven't mentioned in the causes for the stress. Usually if they have stress, they will have abnormal bleeding, but they won't have excess bleeding. They will go into amenorrhea. In that case, it stops on its own. If they have got excessive bleeding, it won't usually stop on its own. You may have to give the tablets. That is, I have already told, that is tranexamic acid or non-steroidal anti-inflammatory agents like Brufen tablets or aceclofenac tablets. Commonly we will be using tranexamic acid. These tablets, 50% of the bleeding will reduce. This they have to take at about 3 to 5 days for the bleeding to stop. For abnormal uterine bleeding, what tests you will diagnose? This is more variety of the tests we have to do. It depends on the diagnosis. If the bleeding is because of ovarian dysfunction, that is PCOD endometrial hyperplasias, then we may have to do dilatation and curettage or histoscopic guided biopsy or endometrial biopsy, and after getting the histopathology report we can give hormones. In the young patients we will be giving hormones. With that, if they take for 3 to 6 months this combined oral contraceptive pills or progesterones, usually it will correct within 3 to 6 months of treatment. If they won't respond, then we may have to do other treatment modalities available for them, like endometrial ablation or Merino-IUCD or DNC itself, or hysterectomy is the final treatment. That usually we won't do in young patients below 40 or 45. If they have crossed 45, maybe hysterectomy is the first line of treatment. ఇది మీరు పెట్టిన క్వశ్చన్స్ ఇది వేగ్గా ఉంది. Most common cause of abnormal uterine bleeding is ovarian dysfunction causing endometrial imbalance and causing endometrial hyperplasias, and then again that's called abnormal dysfunctional uterine bleeding, where there won't be any cause is found in the uterus, ovaries or in the pelvis. Then other common cause is fibroid uterus for abnormal uterine bleeding. This is normal.